Hello, everyone, and welcome to Healing Connections. I'm your host, Emmy Vadnais. Our topic today is Foundations of Whole Person Care with Arlene Schmid, who has been an occupational therapist for over 20 years and started to use yoga with her clients in the late 1990s. She is a professor in the Department of Occupational Therapy at Colorado State University. Arlene is co-editor of Integrative Rehabilitation Practice, the Foundations of Whole Person Care for Health Professionals. Arlene develops and tests yoga interventions for people with disabilities, including, but not limited to, stroke, traumatic brain injury, chronic pain, neuropathy, and Parkinson's disease. She has over 100 publications, most of which disseminate yoga research. Welcome, Arlene. It's such a pleasure to be with you.
Hello, good morning. Thank you so much for having me.
Yes, congratulations on your fabulous new book that you have co-edited with Matt Erb.
Thank you.
This is the topic of our discussion today, Integrative Rehabilitation Practice, the Foundations of Whole Person Care for Health Professionals. And could you share a little bit about how this book came to be? It's such a wealth of great information, and I really hope it becomes a textbook in many health programs.
Sure, thank you. Yes, this is Matt Erb's, I would say, baby. He came, he's a physical therapist, and he has done a lot of work in integrative rehabilitation and practices, and somehow knew all of the right people to ask to be authors for this, and knew all of the right content to be included. And essentially, he was looking around for an occupational therapist to co-edit it with him, and we found each other. I'm very happy to say it's quite a few years ago already, because this was quite a work in progress for a long time. And we worked together. I've not ever actually met Matt in person yet. We've done everything online together for a couple of years. And Matt was really able to pull all of the very many authors together to bring this together and make it come to fruition. And so it was a really great product. I think we definitely hope that it is included as a textbook in many occupational and physical therapy programs across the country, or even internationally. Some of the authors are also international. And I think it gets us to the point of treating the whole person the way we've been talking about in occupational therapy for 100 years. But I think it has some really great content of case studies, but also kind of how to do this, how to really treat the whole person rather than just saying we should treat the whole person. And I think it took a lot of time and energy and effort, but the final product is something I'm really excited about and really proud of, and happy to work with Matt and all of the very many co-authors that were involved in it.
Yeah, I recognize some of the names in here. Betsy Shandalove is an occupational therapist who I've definitely interacted with, who's been doing some great yoga teaching across the country for over 10 years. And some of the topics I'm just reading from the table of contents here are exploring the breath, exploring meditation, sensation, imagery, movement, cognitive behavioral integration, exploring spirituality, avenues of expression, finding your voice, music as medicine, nutrition and food, and yoga therapy. And so it really has a nice grouping. How did you choose these various topics for this book?
Yes, so Matt and I came together, and he already had quite a list of things that should be included. And then we kind of just went from there, thinking about what occupational therapists should know and physical therapists. And there's some work by speech therapists as well in here, and thinking about what do we want people to know? What do we want people to be able to fully integrate into their practice? Thinking about new graduates. I'm a professor here at Colorado State, so I am teaching the newest of new young OTs out there. But then also for people who are senior therapists and are kind of learning about integrative rehabilitation for the first time, and trying to give them some really practical tips of how to do this, including what I think is really important is some options for self-care. As therapists, we give so much to our clients, and we talk about burnout often. We talked about burnout before COVID happened, and now I think it's just something that's really important for us to talk about our own self-care I really talk to our students about being in the moment when they walk in with a client and kind of leaving all of their other stuff at the door and being in the moment and just allowing them to be the best therapist that they can be. But I think our new grads need to hear that, but our senior therapists need to know that as well, because they weren't necessarily taught to do good self-care. Back when I went to school in the 90s, we weren't really taught that necessarily. And we all know that we give an awful lot when we're the best therapist we can be. We're giving a lot of our heart and soul when we do that.
Yeah, definitely. I know that you and I went to OT school around the same time, and therapeutic use of self is definitely an aspect of all really healing professionals. And the more that we can take care of ourselves, the better we can help others and provide care and help them to take care of themselves. And one of the things I love about integrative health, which I want to talk about the terminology in just a moment, is that integrative health has formerly been known as complementary alternative medicine. Since we've gotten more research on it, it's become more accepted. Is that many of these approaches can actually help with self-care like you're talking about. Are there any that come to mind for you that stand out that you think people listening or healthcare professionals could really benefit from if they haven't already adopted it, or maybe some topics they might want to learn about in your great book that you've co-edited, or maybe take some more continuing ed classes on?
A couple that really come to mind and that I really talk about with our students are simply to take a breath, right? Thinking about the vagal response, calming ourselves down before we walk into a room, but teaching them about the physiological response of taking that breath, that it's not just us saying, oh, take a breath and relax, but that there's this very specific response that's happening in the body. And then certainly, because I'm a yoga researcher, I really talk a lot about about yoga as a way to help manage stress and anxiety, but also the flexibility and strength that can come with yoga, as we probably as OTs and PTs have all been at risk. If we haven't hurt ourselves, we're definitely at risk for hurting ourselves. So I think yoga is a good self-care practice that includes some physical practices that can help improve flexibility, strength, range of motion. But that includes the mind and breath combination, and that breath work that can really help us to relax. I know a lot of our students are getting ready to graduate in May. They have a lot going on. And so just like therapists, right, they kind of tend to run a little high up here and run a little anxious. And so it really helps them to remember to ground themselves. And so I think as therapists, if we can remember, take a breath, ground ourselves, walk into every room, being our whole person and being really thoughtful about being in the moment with that client and not worrying about writing all our notes, not worrying about the next client. I even think things like that leads to fall prevention. If I'm the therapist in the room, really being in the moment, I'm really attentive and can be the best therapist, but we can decrease risk of falls for the client. We can improve our safety, their safety. And so I think those kinds of practices are really good for self-care for the therapist, but then it's also really good modeling that we do for our clients, right? If they see us being in the moment and taking care of ourselves, hopefully that shows up for them. When I'm meeting with students, I try to be only meeting with that student and not worried about the emails coming in or the texts coming in, but that whole idea of being in the moment and practicing that. I hope I can teach them that, and then they are hopefully teaching their clients that. And then we are just enhancing self-care as we go. That's kind of my hope and dream, but definitely from the book, I think there's great information about yoga and breath work and the mind-body connection as well, that I think is just so powerful, but often ignored or missed by folks.
You and I met a few years ago, I think it was, when your Yoga for Stroke book came out, which is also a wonderful book. And it's not just about, people hear yoga and they often think of the poses, the postures, the yoga asanas, but you go really in depth about how yoga can help healing stroke. And it was the Healing Connections podcast, episode 12, I believe it was titled Yoga for Healing Neurological Conditions. And in your book, you highlight how, in your research, and correct me if I'm wrong, that people who have had maybe a stroke status post maybe 10, 20 years, who sort of had what sometimes is referred to as maybe plateaued or not making as many gains anymore, that through that yoga therapy, they were able to make improvements again.
I mean, I'm really proud of that book as well. And much of my research has been for folks with stroke and neurological conditions. We just finished a study for folks with brain injury. But what I think, and I keep coming back to, is 8 weeks of yoga did so much for folks, but it cannot be just the physical postures. In my head, it must be that mind-body connection. And that because of yoga, because they were more in the moment, in their own self, I think that they became more okay with where they were after their stroke, and that just kind of allowed them to have enhanced recovery, even 20, 25 years after the event. But I really do think it's that mind-body connection. There's no way it's just the physical movements that can change someone 20 years after the stroke. So I really think it's that connection, allowing them to more fully recover. It's something we've been toying with. The idea that things like trauma, we know certainly impacts the mind and the body, but that potentially, a stroke is very traumatic for folks, or a fall is very traumatic for folks. And maybe if we can help people a little more manage the trauma, or be more in the moment, maybe we can have better rehabilitation outcomes. We don't quite know that right now, but it's something that I think is probably likely to happen. But I do think that trauma, or where they're sitting, or their regrets, or just not being in the present moment, is really holding folks back from their full potential for rehabilitation outcomes. Yeah, I think people are really focused on what happened before. Why did they have a stroke or a brain injury or spinal cord injury, or what will happen in the future, right? How will I go back to work? How will I hold my babies? And they're really not in the present moment to fully get to recovery.
It's that mental and emotional aspect that yoga, when you really do practice the 8 limbs of it, shall we say, and really allow yourself to be with your own consciousness, that full mind, body, spirit healing can happen.
Yes, we actually just published a paper that is for veterans with post-traumatic stress disorder. And the yoga therapists never talked about the 8 limbs. However, what our analyses show is that the veterans, when they talk about their recovery, all naturally actually talk about the 8 limbs of yoga. And they don't use that language, of course, right? But if you start looking at what they talk about, they're really talking about the 8 limbs and being less attached to who they were before and things like that. So it's really fascinating that even when we don't specifically use certain language, but if we're using the whole practice of yoga, we're still having those really positive outcomes with folks, which is really interesting.
Perhaps they're able to move through some of their grief and maybe come to, like you say, some sort of acceptance.
Yeah, I really, really think that is part of it. Some of the folks who come to mind, maybe after a stroke, particularly one person had his stroke when he was young, in his 40s, and it completely destroyed his plan and his life and raising his kids and all of those things. And I really think he was stuck there for 20 years. And being able to more accept where he was in life allowed him to just have more recovery, which partly makes me sad, right? Because he could have had that recovery in his 40s if we would have known that, if we could have figured that out. But it really shows me the power of the mind-body connection. I think some of what's talked about in both of these books is that mind-body disconnect after injury that I think is really common. It's so common after trauma. It's so common after many physical injuries that people just give up on their body, and that reinforces the mind-body disconnect. And so once we start using integrative practices like yoga or meditation, we can really start to see that improved mind-body connection, improved acceptance, and improved outcomes for our clients.
It's just fabulous. Well, my mind is going to, I hope we can have more podcast conversations, Arlene, and just continue to feature you, because you have been publishing so much, and I can't wait to learn more about these studies a little bit more in depth as well. So like I was saying earlier, the language has been transforming over time. So back in the 80s and 90s, these kind of approaches, at least here in the US, right, because it's really maybe more culturally specific to this Western society, it was known as alternative medicine because it was an alternative to what has been sort of been accepted as mainstream healthcare, and sometimes referred to as complementary alternative medicine. In fact, a lot of the old journals and literature that was published, you would use a search CAM, complementary alternative medicine. And then it started to move into integrated, well, sometimes people call it holistic therapies, holistic health, because that's really, and now I kind of see it kind of moving back into that direction again. But then it moved into integrative because a lot of research started coming out validating many of these mind, body, spirit approaches, like yoga, like meditation, Tai Chi, these various approaches that have been sort of newer in the last few decades. And then integrative medicine became the term because as they got accepted, they would become more integrated with mainstream healthcare. And now I noticed that you've got the whole person in the title, and I've been hearing a little bit, and even the National Center for Complementary Integrative Health used to be NCAM, excuse me, National Center for Complementary and Alternative Medicine. So why did you title it or have the subtitle with whole person, and why is that so important to highlight now?
Yes, I mean, all really good points as we're shifting. And part of it is medicine, I think, and part of it is rehabilitation, right? As our rehab folks, we just have a different lens when we're talking about people and whole person and where we're trying to get folks. I think integrative is really important to think about that instead of alternative. But I think the idea of truly integrating practices into rehabilitation. I was just reading in the last couple of days, something over 50% of medical physicians actually prescribed something that is considered complementary and integrative in, I think, 2020. So over 50%, which is lovely, right? Because before these things were really poo-pooed, even 15 years ago, 20 years ago, when I started to do my PhD, and I specifically went to do my PhD to learn about doing research on yoga, that was really thought of as completely ridiculous. And why would I do such a thing? So I think doctors are really more accepting of it. Clients are really more accepting of it. Therapists are as well. And so I think the idea of integrating it into practice rather than this idea of, well, you've tried everything and it didn't work, so now try this crazy hippy dippy thing. We've moved way past that now. And so now we're really integrating it. I have two friends who are going through cancer treatment right now. And part of cancer treatment is now acupuncture, is massage, and is yoga, which is really fabulous for folks going through that to, again, be treating the whole person or the whole body. And coming back to kind of your question there, why treating the whole person, right? I think we've learned that if we only treat the body or only treat the mind, it just doesn't work for us. And we've been doing that for a long time. And people have moved really far that way to really only treat the body and maybe only treat a muscle or a joint. And we now know that does not work, right? Muscles and joints impact the whole body. Pain impacts the whole body, impacts the mind. And so I think it's taking us a while, right? But we have learned that is not working. And I think therapists who have figured this out, who are treating the whole person, are having better outcomes, but they're also not killing themselves in doing so, right? I think they're having better outcomes. They have better relationships with their clients. I think they're more satisfied with the therapy that they're providing, and they're doing better and their clients are doing better. But I think, yeah, treating the whole person, right? Whatever we want to call that, mind, body, and spirit, mind, body, and soul, kind of making sure to address the mind-body connection, like we just talked about, right? That so many people are walking around kind of disconnected because of injury or trauma. If therapists can think this way, I think we'll just have much better outcomes if they're treating the whole person. And not trying to dissect parts. I know people are trying to do that in yoga research. They're trying to talk about yoga research as, well, we should just do postures and we should just do breath work. and we should just do meditation, but then it's not yoga, right? So I think of it kind of the whole thing with whole body. We can't dissect those components because then it's not the whole person anymore.
Yeah, absolutely. I would imagine that you and I chose to become, or one of the reasons we chose to become occupational therapists is because occupational therapy theoretically addresses the whole person. And as here again in the US and Western medicine has in the last several decades gotten more into managed care and has gotten really fast paced, that being able to address the whole person has become not as primary. And so I really appreciate what you and Matt and all these wonderful co-authors have done in this book to bring forward how important it is to focus back on the whole person. In addition, in that time in the last few decades, more of these approaches like yoga and acupressure, Reiki, Qigong, energy healing, healing touch, a lot of these approaches have really become more deeply utilized by practitioners. And so I just want to again thank you for the ways that you have been bringing this forward. In this book, it talks about rehabilitation. How much do you feel that the information you're putting forth here can also help with health and wellness and prevention?
Certainly so much. I mean, I think part of whole person care is also prevention, right? So if we're treating the whole person, we're also trying to prevent the next thing that could happen. And so I also like to think of whole person care as the family, as the environment. It's not just the client. And you know, we can be very client centered and whole person centered, but I think we're best when we're treating the family, the environment that the person is living in, or at least considering those things. But yes, I think prevention and wellness is such an important component of this. Again, especially even with the therapist, not even just the clients, but thinking about self-care, and again, modeling good self-care to our clients, to our students, to be able to be in this profession for decades, and still be able to do what you want to do at the level that you want to do it. But yeah, I think prevention is such a big component of this. You know, one of my dreams is certainly that we keep providing the evidence that these interventions work. Insurance is very much evidence-based. And so my dream is that we start seeing insurance pay for some of these modalities, if we want to call it that in insurance language, so that we can treat and prevent some disease and disability for folks. That would be my dream for sure.
Yes, and I do know that there are occupational therapists who are billing for these services and getting reimbursement. However, I think you're also talking about prevention and wellness, which is one of the key practice areas in occupational therapy is health and wellness, because we now know the World Health Organization has put out stats that 80% of some chronic conditions can be prevented through lifestyle choices.
Yes, I mean, absolutely, like phenomenal numbers, right? But right, exercise, meditation, nutrition. This book has an entire chapter on nutrition and whole health in that way as well, which was a great learning opportunity for me because it just great content in the book that I don't necessarily think about, right? But that's why we have lots of great authors and we got to co-edit it and read all of it multiple times. But yes, I mean, prevention is such an important component. And if we can do it as therapists, you know, hopefully we see less strokes and less other injuries, less diabetes, right? I would love, we were chatting before about the amount of anxiety and depression that we're seeing post-COVID in our students who are so young and really, really challenged right now. But they didn't know about necessarily breath work and meditation and why those things work, right? Our students are these brilliant young minds. They want to know why things work. And so I think if we can talk to them at that level, like physiologically, these are the changes that happen. These are the reasons breath works. Our students love to hear that. They want to have the reasoning behind it. They want to know the evidence behind it. So I think it's slowly happening, but slowly.
Yeah, something that I'm a huge advocate for. I'm really grateful. I don't know if you know this, Arlene, but the American OT Association actually just created with Mandy Lubas and Michelle Bradshaw, who are both occupational therapists, the new Integrative Health an occupational therapy commission on practice group. So basically they're recognizing integrative health as what's formerly been known as like a special interest area or specialty. So that's fantastic.
Yes, that is fantastic. And I hope it really helps us integrate better than just having it as this add-on, like we've already discussed.
I'll just go ahead and put a shout out here to anybody listening from ACOTE, the Accreditation Council for OT Education, that having a particular standard on whole person care, integrative health, whatever we're terming it, I guess, well, now it's being called integrative health within AOTA, that we can have a standard so that we can have all these great approaches that you're talking about, Arlene, and all the co-authors in here to be taught to these students so that they can begin integrating it. You know, when I was an OT student, I took a Phi Ed class. I had to fulfill a couple credits, and one of them was a tennis class and one was a relaxation class. So this was outside of my health classes. I actually double majored in psychology. This is back when it was still a bachelor's degree, did my OT, and then I took this relaxation class and I had 19 credits. I was working full time. I was so stressed. And for one time a week, we would go and we would lie down and listen to 2 guided recorded meditations for about 20 minutes. We did some other things in the class, but just for 1 hour a week. And let me tell you, my stress levels came down so much. I walked away from that class with an I can do this attitude, and it really just balanced me out. And so that was my senior year of OT school, and I was able to finish with a lot less stress and anxiety. So I think that if we can integrate these in fact, Jen Willoughby Voteman just wrote a great study, and I put it up on holisticot.org. I think it's something about building stress resilience in occupational therapy students. And she did a study looking at bringing in these various approaches for students to benefit from managing their mental health so that they can improve their self-care, at the same time learning skills that they can use with their clients when they're done with school.
Yeah, I think it's so powerful to teach them something to use now and then to continue to use with their clients and for their own self-care. We are lucky here at Colorado State. We have a center for mindfulness. And so the students really have access to quite a lot of mindfulness. The problem, of course, is they have to sign up for it. They have to go to it. But once they find it and figure it out, it makes a huge change for them and they really stick with it. And I see it because they're doing case studies and things like that in my class. And not 100% of them, but very close to that, include some level of intervention that we would consider complementary and integrative practices, often yoga, often breath work and meditation. I unfortunately don't get to see them until their very last semester of OT school. And so I do wish that I saw them earlier on to help them develop these practices throughout their coursework, just kind of like you, right, in your very last semester. But it would have been so helpful to know about it all beforehand. And so I don't know quite how to do that, but our students are certainly hearing about it because I'm here, and I'm of course going to tell them all about the power of yoga and breath and mindfulness and integrative practices. But I agree, until ACOTE makes that standard, it will not be happening at the national level. So I would like to see that, of course, but I'm quite biased about this. But I'm happy to chat with folks about it too. And I think we can integrate it into OT education really very easily in multiple aspects of their education, but we can have some good outcomes with that. And I did just see that resiliency of OT students, but I think it's important. And I think, again, post-COVID life, we'll be talking about post-COVID life for a very long time and the impacts of it. But hopefully part of those things are that people are learning better self-care, taking better care of themselves as they are in school and then once they graduate as well, I'm hoping.
Pain is one of the main ways that people enter into the healthcare system. How can whole person care assist with physical pain? And of course, we know that also can connect with stress and emotional pain as well.
Pain is such an interesting topic, right? In so many ways, it can be so related to trauma. It can be related to disease, disability, a specific event. Pain science has taught us so much in the last decade, right? About things like complex regional pain syndrome, about how people can manage their pain, but sometimes pain really becomes their identity, is some of the things we've learned. one of my favorite quotes from someone in one of my studies was something like, it was a yoga study, and he said, well, it didn't make the pain go away. It just made me focus on other things. And so I think he was so caught up in the pain, which I think is true of a lot of folks living with chronic pain. It allowed the yoga practice, the mind-body connection allowed him to start thinking about other things and be focused on other things than only his pain. We did one study where we started off as, I think, 3 months of yoga, and the facility was so happy with the results. They actually hired an OT who was a yoga teacher, and they continued yoga for 2 years. And one of my thesis students interviewed some of the folks who had done yoga for 2 years. It was life-changing for people. They didn't even talk about their pain anymore. It was fabulous and fascinating, right? Because before, when you asked them anything, how are you today? They said, well, I'm in pain and I was in a car accident 10 years ago. But after 2 years of yoga, once or twice a week, relatively consistently, and you said, hey, how are you? They were like, I'm great. I'm going to the grocery store. I'm buying my own groceries. I'm driving. I'm getting on the floor and playing with my grandkids. But there is no more conversation about pain. If you ask about pain, they're like, oh yeah, I'm still in pain. The pain hasn't necessarily gone away. It could be less pain, but what we call pain interference, how pain interferes in day-to-day life, subsided substantially for folks. And we did the COPM with them, and really shocking, amazing results with their satisfaction with performance in their activities and their occupations. So I think pain is challenging and tricky, and every therapist is going to come up with folks with pain, regardless of where you work. But I think there's ways to help manage it through mind-body interventions and mind-body connections. I think pain is definitely a population where people become really disconnected from their body because they want to, or they choose to, right? Because it's easier, excuse me, or it might be easier to detach from what hurts. And then that has some negative results for them. So I think trying to reconnect, do mind-body connection can really support their long-term or rehabilitation outcomes.
And how much do you think a physical therapist or an occupational therapist providing yoga, who's been properly trained, maybe has had at least their 200-hour RYT, or maybe you have some recommendations on how much training you think they ought to have. How much do you think an OT or PT providing yoga is different than maybe somebody else who is a yoga practitioner or yoga teacher for these kind of outcomes that you're seeing with your research studies?
Yeah, I do tend to hire OTs or PTs who are yoga teachers, because I want the teacher, or I want the therapist to be able to modify and meet the person where they are. And I think OTs are particularly good at that, of course, right? We do activity analysis all day long, and so we can meet the person where they are. And our studies are typically with people who have a lot of disease and disability. And so I like to make sure I feel like whoever is working with them can handle a medical emergency, can prevent a fall, so can really be thinking of the whole person, but all of their needs at the same time. We do group interventions most often. And so I think, OTs have a long history of mental health and group interventions. And so there are many skills, I think, that go into being able to run a group yoga intervention. I do think having a therapist with some experience in there with group, with yoga, with modifications, with disease and disability is really quite important. So asking about training, I think all of us can work on our own self-care. I think all of us can tell someone to work on their breath and take a deep breath and go rest and calm themselves. I think once we start getting into things like yoga, biofeedback, nutrition, thinking about different aspects of this book that we're talking about, then I think we start needing some additional training, whether it's yoga, whether it's whichever one of these components that you want to get into. I do think we need some additional training to do it correctly, to make sure we don't cause any damage, safety issues, fall prevention. A lot of my work is about fall prevention, and so that's why that kind of keeps coming up for me. But I think therapists can look at the whole person really well and think about, okay, they have this disease or disability, and this is where I want them to try to get to, right? So we can be really goal-centered, we can be really thoughtful about how do we help modify them, how do we keep them safe. But I do think therapists have that eye that not everyone necessarily does.
What does spirituality or God mean to you?
Well, that's an interesting question. It's funny because in yoga research, we have been careful about God or anyone else because sometimes we're federally funded. And so we keep those things really far apart. So more often what comes up is kind of spirituality and whatever someone would like to think about. So for me personally, I think there's there's something way bigger than us. I'm just not quite sure what it is. But I think I've seen the power of trying to connect all of these pieces and addressing the whole person. And so for me, it's kind of whatever my client or study participants want to think about or want to include. I am all for it. And whatever meets their needs the best, I am really fine with it. We have a great conversation in class about this. The idea is like yoga is devil worship, and you'll hear that in different parts of the country. Less now than 15 years ago, but definitely, like, I have been told, nope, devil worship, I cannot be in your study. All the way to people doing yoga, their yoga practice, but thinking about their God or Jesus or Mary, or having pictures of saints on the wall. So really merging their religion with the practice of yoga and meditation. And, prayer is meditation, right? So it's many things for many people, which has been interesting to think about from a funding perspective, from group yoga with people from many different mindsets and abilities. So it's been kind of interesting to make sure if we're addressing the 8 limbs of yoga, how are we doing that in a way that meets everyone's needs?
Right. And as healthcare professionals, while we might have, certainly we would have our own perspectives, such as yourself, we are trained and it's necessary for us to be culturally respectful,
Yeah,
and to honor everybody's viewpoints and support their own belief systems, because ultimately that's what's going to help them heal the most.
absolutely.
In their own spiritual framework, if they have one, or and if they don't have one, to not judge them either way for that, and to accept where they're at.
Well, and even I worked in the VA for a long time, and people who were kind of like Vietnam veteran era, they really had a negative idea of yoga because of the timing of the 70s and what they call it. They were like, I'm not doing that hippy dippy thing, right? Because of what came back when Vietnam veterans came back, or what happened when Vietnam veterans came back. And so they've really had a negative connotation about the idea of yoga. Versus now the VA is one of the biggest proponents of yoga. It's really happening, but that's because of the Iraq and Afghani veterans coming back, being just a different age, a different generation and mindset, and saying, I don't want more pills, I want mind body. So now the VA is doing a really nice job of doing mind body work. So part of that is generational in addition to cultural. So yeah, lots of things to consider when we start looking at integrative medicine.
I actually know an occupational therapist who took a few of my holistic healing courses, who's at the VA in DC, who is helping to develop the program, that national program, or at this point has probably developed that program. Yeah. So it's great that you're seeing that change happen. Arlene, thank you so much for being with me today. Is there anything else you want to share before we wind down?
Oh, no, I'm just so excited that you are here and doing this really great work, and that there's so many occupational therapists out there really invested in holistic care, the whole person, and being the best therapist that they can be, and providing the best therapy that they can do. So I'm just so glad to be part of the big picture and part of the wheel.
Wonderful. Thank you for taking the time. I know you're quite busy with everything you're doing, and we're so grateful. And for those of you who are joining us today, until next time, be well.